We didn't know until it was too late.
And that's what we're hearing from family members who've lost loved ones living in nursing homes to coronavirus. Investigative reporter Chris Horn looks into this lack of communication at such a crucial time.
Family members have told us they were not alerted when their loved ones were isolated for COVID. They say they were left in the dark, left to wonder about their loved ones who were dying at the time they needed to know most.
Devastated from all of it.
Deneen Brown says her family wasn't informed about her grandmother's condition here at Autumn Care of Chesapeake.
The communication was awful. My mom had to keep calling up there.
Brown says her grandmother was put in isolation for about 3 days and the family wasn't told that she had been moved. Brown and her mother were able to visit that April Sunday from a distance.
What was disheartening was when we knocked on the window. She didn't know who I was. She didn't know who my mom was.
Just a few days later, her grandmother was dead from coronavirus.
The fact they still wouldn't even call just to say, I'm sorry for your loss. So.
At another Autumn Care home in Suffolk, Franklin Whitley wasn't eating.
They wouldn't do anything I asked them to do, and then I went there Tuesday morning early and found out that they were packing up all his belongings.
Franklin Whitley was now in quarantine, but just who made that decision and why became a perplexing puzzle.
They told me that they had to move him over there. It was doctor's orders. Then someone told me that, well, the doctor himself told me that he never ordered him to go to quarantine. Then the facility tells me that the doctor doesn't have to order it. They can move him if they want to, but at 2 o'clock in the morning, and they don't even call and tell me anything.
She asked to speak with the administrator and the director of nursing.
And neither one of them would come out and speak with me. No one would talk with me and let me know what their plan was, why they moved my dad at 2 o'clock in the morning.
Later that week, Franklin Whitley died of COVID in the hospital. We asked the parent company of Autumn Care, Sabre Healthcare Group, COVID questions about communication with family members, follow-up testing for positive residents, and what happens when a staff member tests positive. Sabre's chief medical officer gave us a statement that read in part how their facilities act in the best interest of their residents and how they've set up personalized care plans and routinely updated all residents and responsible parties regarding their condition and care. Governor Northam called for a special task force for COVID and nursing homes led by the State Department of Health.
We definitely encourage that facilities have regular communication with family members and loved ones, and it only helps.
The task force can make recommendations for communication plans for nursing homes, but they don't have the power of law. However, state authorities can monitor compliance.
A plan for how they're going to communicate, a plan for how often they'll communicate, and the surveyors would then be looking for, is the facility following the plan?
The governor's task force is also working on getting more PPE and more test kits to nursing homes and reducing the turnaround time to get the results. A nationwide survey says many nursing homes are waiting 4 days or more, and given the vulnerable population involved, it's a time when time is of the essence. Chris Horn, 10 on your side.